Thank you, Natalia. I'd like to welcome everyone. The role of tonometry in the era of AI. That's a very important aspect because, in my view, well, tonometry, when we measure intraocular pressure and the parameters that can be determined at the same time, is not being paid a lot of attention. Tonometry is considered to be a simple method, and in my presentation, I will try to show you that tonometry is a more complex method than it is traditionally viewed, and that there are data that we can obtain which are quite efficient, and of course, AI should be used here for the analysis of such data. We are working in this direction, but I would like to start my presentation with some kind of generalization. Today, we're talking about AI, and of course, we consider AI as an instrument. Dr. Zhang talked about a black box, but of course, the word artificial means created by a person. So that's the intelligence created by us, by people. And we can see that, well, man is participating in the creation of this intelligence.
We need to look for some principles in glaucoma in general. And today we will talk about the principles we can use and find in measuring of intraocular pressure. Another important thing, which is extremely important in the discussion of AI, is that in the real practice, when we examine the patient, we see that many methods of ours based not on the analysis of the static situation, but on the analysis on how we can change something. So that means normally such data are much more interesting and informative. So I think perspectives of attracting artificial intelligence also should be related to the fact that we need to look for methods for dynamic analysis that later on that could be later on analyzed, and where AI could be very useful to analyze. When there is a lot of data, then a patient may not manage with this analysis. So, in fact, AI is needed for three main directions, and today all of them were in fact presented. The first one is diagnosis, and here you can appreciate some challenges related to that, problems in glaucoma diagnosis. These problems applicable both for clinical practice and the use of AI there. The second here is the identification of artifacts and making prognosis for one particular patient. Here we have even more challenges because all the characteristics that we talked about today are mainly focused on the analysis of the current situation. And if we speak about the analysis of image, then looking at the image, only image, is very difficult to make the prognosis, because the basis for the prognosis, it's either the series of images that we obtained with some intervals, or it could be intraocular pressure. That in glaucoma patient is very important. Looking at the level of intraocular pressure and comparing with the norm, we can suggest this or that scenario. And in the scenario, the decision is made about the treatment or just monitoring of the patient, and I think that's the most important. So that means prognosis and decision making. So that's what we have to pay attention to in the development of AI in glaucoma. Problems in tonometry. Problems in tonometry mainly related to the fact that patients are different from each other. and the devices are calibrated for the, let's say, average virtual phantom of the model. And definitely the reason of big challenges here is keratorefractive surgeries which are carried out, and particular challenge could be developing dry eye syndrome in patients with glaucoma. So in this context, in order to systematize this challenge, I have to speak about the key role of corneal symmetry. The point here that patients without any interventions, normally cornea has circular symmetry by LASIK, by keratotomy. It is broken by mechanics and broken circulum. The only thing is the contour tonometry or point tonometry, which can be useful. So now we have these devices available, and even if the circular symmetry is broken, we can get much more reliable results, real result, and this is extremely important. We have many patients in Russia after radial keratotomy, after LASIK. There are other patients with scars of the cornea, and for these patients, the key thing is that applanation methods and traditional control of the intraocular pressure is less effective. Modern laser technologies leads to very strong changes of biomechanics. So biomechanics is deformed, so for these patients we need other, more comprehensive methods. So that means, so when we measure intraocular pressure, IOP, we need to analyze something else. And what is that? These are biomechanical properties, and also the technology of aura, which is IOPCC, Corvis, and we can register directed applanation using Corvis or Schoenfeld chamber. That's quite complicated result in tonometry. Why is it so important? Well, we got used to that the measurement of the ocular pressure is done in the central compartment of the cornea. This is obvious and, let's say, intuitive. And there are reasons to that. It is related to the fact that this area is mechanically has the highest tension. We measure the pressure in the maximum tension area. This is a maximum strain, but maximum strain is not always centralized in the cornea. Patients after radial keratotomy, so these are the patients where the strain field pattern changes after the corneal incision, and the pressure shifts, and the shift of this biomechanical accent leads to the regression effect of the surgery. And right now we need to keep it in mind during tonometry, so we should measure not in the central area, which in fact is loosening in this patient. Loosening, yes, drooping. It's not the best term, but it characterizes mechanical compartments. So in these patients, we see maximum strain in the periphery, and we offered this approach, and we use this approach clinically. So this is the measurement in the mid-periphery in the patients when they have scars, and patients after LASIK or keratotomy. So measurement of cornea compensated IOP is very interesting method. Here we have parameters that minimize biomechanical specificity of one specific eye, and this is very useful. What we get here could be really serious. So this is a clinical case of a patient after refractive surgery where there is 6 millimeters mercury, and that's the difference between the results. And besides, also we get the mechanical characteristics of the energy which is absorbed, which is corneal hysteresis, which can be analyzed. And according to RAWI data, it allows to make the prognosis for the patients with glaucoma. And last but not least, if we talk about the convenience of image visualization and analysis using AI, so keratotopography, that means signature, the pattern, so all that is related with the changes of IOP. So this is very famous statement, but normally we don't pay enough attention to the fact that the dynamic analysis of keratotopography could be one of the ways to control IOP. And actually, IOP monitoring is based on that using contact lenses. And I think the simplicity of these images could be one of the ways how to introduce tonometry into AI models. Next challenge. We don't always able to interpret this result. We know that glaucoma progresses due to the vascular and mechanical factors. So when we measure the norm, we offer to use two approaches. One of them is to use blood circulation analyzer and comparing circulation blood flow and the axis, comparing blood flow and axis. So we offered the method to study individual norm of IOP. So using this formula, we can get biomechanical coefficient of corneal and scleral stress. So this is the biomechanical analysis, and this coefficient could be the reason to later on assess the prognosis of glaucoma risk in patients. Actually, search of algorithm for decision making in glaucoma is continuously done. So these algorithms could be found in the clinical guidelines, and here you can appreciate therapeutic algorithm for glaucoma treatment from European Glaucoma Society. European guidelines are here. We have more complicated models to identify the target level of IOP, and historically, the School of Academician Vodovozov is leading in this area in Volgograd, and already for quite a time ago they offered the app. Using the smartphone, you can be guided with the level of the target IOP. And we, from our side, we are looking for opportunities to carry out similar analysis, and we believe that biomechanical study, contact contactless study using ocular response analyzer gives us enough data to get particular level of biomechanical compensation of intraocular pressure that later on could be used clinically, and then the training of AI by the results of biplan applanation, not only in the context of pressure, but also in the complex of all the results, could later on give us quite reliable prognosis of glaucoma progression. And last but not least, making tactical decision in glaucoma and creation of particular algorithms. So in this context, we have some publications as well. So if someone uses AI, then first we need to offer, let's say, for ourselves to get into the depth of the problem, to see particular uh, reasons and causes, and later on we will train the machine by that. And I think very important here is the search of particular algorithms of results analysis. And this analysis in points and grading, where looking at the total number of points, scores, we can offer to the doctor this or that vector in the management and treatment of particular patients. Here are the examples of cases where based on the clinical data, simple clinical data, and some of them were obtained in dynamics. So what's the problem of implementation of AI? When we assess glaucoma, we identify the risk factors and the calculation of risk factors. So these are the things We need to pay attention to that before we introduce big data to the serious models of AI. And if this data not sufficient or not quite correct, or if there is too much of this data. So this is how we can simply postpone the era when AI would be our practical assistant. So yet we need to help AI. We need to help AI now, and in this situation, the quantitative analysis of particular factors can offer us a solution, and mainly it completely coincided with the position of the expert. So, summing up my presentation, I would like to come to the conclusions. Glaucoma is a very important scientific challenge, and we're searching continuously for the solution. Definitely, AI is a must thing to go because the amount of data we are getting is really huge and hardly can be managed manually. Not everything what we're getting now from glaucoma patients could be easily described by the algorithm, or let's say algorithmized, but the approaches are here and they should be developed, and then AI would be more and more implemented into practice, and we need to look for different principles that we train AI. Personalized approach to the management of IOP and in parallel measurement of biomechanical parameters, blood flow parameters, and some other data during the tonometry study is important not only from clinical position because it clarifies the result, but also it extends the option to use AI in this area, because at this very moment tonometry in the models which are related to the use of AI is still quite limited, but we fully understand that the diagnosis of glaucoma and the prognosis in glaucoma and the selection of tactics of treatment in any case are related to this key risk factor. That is why this factor should be obligatorily introduced in the model of AI, and most preferably it is to be analyzed through the prism of individual specificities of one specific patient we are dealing with. And definitely, the choice of method how to measure IOP plays critical role, and we have been using for quite a time cornea compensated pressure as a main parameter in the assessment of patients with glaucoma. We are using, so in case of radial keratotomy, we use point-based contact tonometry, and if we train AI something, then AI should be trained with new data, data which are relevant, significant, prognostic, and that had new modern level of reliability. And I think even Goldman tonometry, that always considered to be the golden standard, so now it becomes the method which gives us not contemporary data, and it may sound quite strange, but no offense meant here. And with that, thank you very much for your attention.